Thank you. Bulabilak. Today we announcing one new border quarantine case of COVID-19. A 25-year-old female nursing officer. She contracted the virus while treating one of our border quarantine cases in an isolation unit. We're considering this case a border quarantine case because this nurse never entered a public space after contracting the virus. As per protocol, she worked and lived in the isolation center with exactly zero contact with the public. She then entered a government quarantine facility, again without ever interacting with anyone from the public. After developing symptoms, while in quarantine, she was tested. After she returned a positive result for COVID-19, she was readmitted to the isolation ward at Nadi Hospital, where she is recovering very well. In fact, her symptoms have since dissipated. Our fellow isolation unit nursing colleagues and medical officers on rotation have all returned negative tests. Out of an abundance of caution, even though they never interacted directly with this patient, all relevant frontline health, hotel staff, and military personnel have been swabbed for the virus and they tested negative. Around the world, rates of infection amongst healthcare staff are amongst the highest in any group. As nearby as New Zealand, during the month of April, 1 in 10 cases were recorded among the healthcare workers. Even when every protocol is followed, even when personal protective gear is employed properly, this unpredictable and unwieldy virus can still be transmitted. Despite more than 3,000 patients held within our quarantine facilities, this is the first positive case confirmed amongst our staff working in our isolation facilities. But given what we've seen around the world, we are quite sure that this won't be the last. This is why we've structured an airtight operation system within our isolation facilities to ensure no risk to the general public. I'd like to cover again exactly how these facilities function. Our medical staffs work these facilities, they go through a roster system, whereby they work and live in the facility for 14 days, then go into quarantine in one of our government-designated quarantine facility for 14 days. They must then register another negative COVID test before they can rejoin their family. This is the most stringent system of isolation unit management in the world, more rigorous than both Australia and New Zealand. Our healthcare staffs all operate in appropriate personal protective equipment at all times. There is no shortage of these supplies in Fiji, and our staff are well trained in its use. We are constantly reviewing and strengthening our personal protection measures wherever we see an opportunity. However, as I said, some risk will always remain due to the aggressively contagious nature of the virus. That's why we must always remain vigilant. This will be our 11th border quarantine case. We currently have 2 cases in Lautoka and 1 now in Nadi Hospital. I know the stringent protocols we have in place are a great comfort to the people of Fiji. But we must never forget, not take for granted, the exceptional sacrifices these measures demand of our healthcare staff. There is nothing easy about living and working away from your family for 4 weeks at a time. There's nothing easy about working to save a life while mitigating against the risk of getting infected. It takes nothing less than absolute bravery to work in these isolation wards. And the Fijians who do so are heroes, full stop. Our medical staff of orderlies, ward assistants, laboratory technicians, nurses and doctors have, together with members of our security forces, that's the RFMF, Navy and police, they've held the front line since the COVID-19 battle began. We have, as a group, weathered criticism. We have endured hardships. We've seen and experienced social and emotional turmoil. But we will never surrender. We will always honor our duty to our people to keep them healthy and safe. And we do so with vigilance, with courage, and with compassion. We noted that several recent cases confirmed at the New Zealand border in Christchurch have been announced recently to have been transited through Fiji while traveling from India to New Zealand. We want to assure the public that these individuals did not contact nor did they transmit the virus while in Fiji. These individuals, they landed in Fiji, they spent 30 minutes in the Nandi airport transit area, interacted with no one, and then they transited onwards to New Zealand. Thank you.
I just wanted to re-emphasize some points that Dr. Fong has made. First, starting with that it has been 137 days as of today since we recorded a case of COVID-19 outside a border quarantine facility in Fiji. 137 days. It's been 166 days since we recorded our first case of COVID-19 in Fiji on March the 19th. We may be the only country in the world to have had an outbreak of COVID-19 and then go this long without it re-emerging in the community. But we must not, and we have not become complacent. We've tested over 8,400 people in Fiji for COVID-19, even when we stopped recording any cases coming from the community. That's close, now it's close to 1% of our population. And we keep testing with all the samples that we receive sent to our molecular lab at Fiji CDC. I'd like to talk a bit about our border quarantine because it's something that, unless you've been through it as a repatriating citizen, you may not be aware of what we actually do. We've heard about border quarantine facilities in other countries, most notably our neighbors, Australia and New Zealand. So for Fiji, we require pre-departure testing, particularly from people coming from high-risk countries. So for India, we require all of our citizens coming from India on these repatriating flights, including the recent Garuda flight that came in last week, to register negative tests. These tests are sent to the Ministry of Health before they leave India, and we cite them and approve them before they come through. The flight from New Delhi that came in last Thursday, it was made up of Fijians repatriating to Fiji, Papua New Guineans repatriating to Papua New Guinea, as well as our Kiribati neighbors as well. And there was a substantial number on board who were also New Zealand citizens repatriating to New Zealand. So all these Pacific Island countries were sharing this repatriating flight. Fiji's protocol for pre-departure testing was mandatory for everybody who was on that flight. So everybody had to register negative test even if they're just transiting through Fiji. So we received 92 people into our border quarantine facilities from that Indian flight, and they are currently undergoing testing as per our protocol because India is considered a high-risk country, and they will be required to test again before the end of the 14-day period in the government quarantine facility. I'd like to talk a bit more about our border quarantine and the history of our border quarantine. So our border quarantine in government-designated facilities began at the end of March when we essentially closed our borders to all but our repatriating citizens. Our mandatory testing of all of the people in the border quarantine facilities began in April. This is 2 months before our biggest neighbors, Australia and New Zealand, where they started their testing in border quarantine facilities just in June. Our military has been directly involved in supervising our border quarantine facilities right from the beginning, from the end of March. We've had no breaches, nobody has escaped, and so far we've managed to contain any cases that have come through border quarantine in border quarantine. We've seen in other countries, most notably in Australia, the tragedy that's happening in Victoria, where the current outbreak happened because of breaches in their border quarantine. And we've been watching what's been happening in those other countries, and that's why we're always constantly reviewing and reviewing our processes in border quarantine. In terms of this recent case, this healthcare worker, to put it into context, in the state of Victoria alone in Australia, over 2,600 healthcare workers have been infected with COVID-19, and around 80% of them have caught it at work. This just shows the nature of this virus. So we've been expecting this. We do all we can to make sure that our frontline healthcare workers have the necessary training and personal protective equipment to protect themselves. But we had an added layer of protection, which is making sure that when they're taking care of the positive COVID-19 patients in the hospital isolation, they are away from the community. They are in quarantine for 14 days while they're taking care of the patient, and once they finish their 14-day rotation, they go into a government designated quarantine facilities for 14 days again and are tested before they're released.
Thank you. I guess what this case again indicates is Fiji is by no means out of the woods. You'd go online and see that the pandemic is going at absolutely top speed. 4 million cases, 4 million cases every 4 days. We now have, globally recorded more than 25 million, cases and more than 800,000 deaths. So Fiji remains at risk. And this case again tells us that even though we've put measures in place at the border and we are practicing all necessary precautions that will stop the spread or the transfer of the disease between those who are positive and those who are caring for them, there is no guarantee that our workers are absolutely safe, and hence need to be continuously vigilant. We are vigilant at the border. Our staff are regularly upskilled and trained and retrained on the measures that they need to continue to adhere to. But the other aspect is also our responsibility as members of the community. We do have a role. We've always talked about COVID-safe measures, and those measures must be practiced. It is the way to stop this virus. So when we're talking about social distancing, we really mean it. We must practice social distancing at all opportunities, whether you are at church, whether you're watching a game of rugby, whether you are sitting in a pub somewhere. You must practice it. It's not just a word of mouth, talanoa kind of thing. It's a deadly serious gesture and habit for each of us to practice and learn. When we talk about closing your mouth and your nose when you cough and sneeze, you must do it. Everyone must do it. Use a tissue paper, use a hanky into your elbow, do it. We must do it. It's a way for us to protect our community. Our health workers, as stated by PS, are working very hard at the border. They're sacrificing. 1 month you don't go and see your family. We just stay around the hospital in Nandi and Lotoka. And after 1 month, then you are tested negative, then you can go. That's a challenge for all of us if we start to ask that we spend 1 month away from home. That's a difficult challenge. So again, the Ministry of Health has not changed its plea for all of us to continue to practice COVID-safe measures, adhere to the COVID-safe measures that are currently in our the COVID-safe recovery framework, and we ask for support from all sections of the community so that we continue to be sure that if and when there is a chance that the disease comes into the community, we are ready and we are practicing safe measures to combat it. Thank you.
I guess the other thing that we should mention also is that just continuing from what Chief Medical Advisor is saying, when we say that we want you to put on your app, the Fiji Care app, Care Fiji app, on the phones, we're really serious when we're asking you to download it. We need it in order for us to be able to do whatever, for us to control any potential break that comes through the border. We need that app loaded on the phones. We need to be able to find people. Okay, so whilst we are very strong at the border, we also want everybody to be ready for the possibility that it will come into the community. And we need people to do the things that our Chief Medical Advisor has mentioned, together with downloading that app that we are promoting from government. Thank you.